this morning's Health Watch, when to say no to your doctor. A recent report found that 30% of healthcare spending in this country is unnecessary.
In the new issue of Consumer Reports magazine, the editors reveal 5 medical tests that could be harmful to your wallet and maybe your health. Joining us now is Dr. John Santa, director of the Consumer Reports Health Ratings Center. Doctor, good morning.
Morning.
I want to start with one that I've been to the doctor before. 25 million Americans go to the doctor every year for back pain. Too many?
No, back pain's common. It's the second or third most common complaint. The good news is that 95% of people get better in 4 to 6 weeks. And imaging in back pain doesn't help those folks. In fact, the evidence is it may hurt them, leading to more surgery and unnecessary tests.
So too much imaging is being done.
That's right.
But it hurts them because it leads to more surgery and more tests, not imaging itself hurting them or being harmful to their health.
That's right. It turns out that 80% of people 50 and over have some abnormalities on their X-rays. Surgeons see that and think, well, maybe we can do something to help. Not so.
I'm one of the 45 million who suffers from headaches, and there's sometimes CT scans, MRIs, this suggestion from doctors. What do you think about that?
Again, a very common diagnostic issue that in most cases people have headache syndromes that can be sorted out by history and by exam. And if you don't have physical findings, sudden explosive headaches, imaging actually can be more confusing, harmful, and costly. So we're getting too many images when we have headaches.
We hear about EKGs or stress testing. You think that's done too much as well?
Well, EKGs and stress tests are great if you have symptoms, if you have heart disease, if you have a lot of risk factors. But if you're healthy, no heart disease, no symptoms, EKGs and stress tests are more likely to confuse than help.
As a female, I've talked to my doctor about bone density testing, and especially because osteoporosis does run in my family. Is that the group of people who should be doing this type of testing, and does it expand beyond them?
Well, that's right. Bone density scanning is good for women 65 and over unless you're a person who comes from a family, or in your case has had fractures with minimal trauma, or is low weight or smokes. If you don't have those risk factors, you can wait until you're 65 if you're a woman, or 70 if you're a man, for bone density tests.
We know a lot of people have sinus issues. I've had sinus issues before, and a lot of us say, oh, I have a sinus infection, I need antibiotics. It'll just knock this out. Is that the right way to think?
No. Sinus infections are one of the most common reasons why people are getting antibiotics they don't need. If, again, your symptoms are mild or moderate, you're in the first few days of a sinus infection, antibiotics are more likely to hurt you, cause diarrhea, rashes, than they are to help you. You should pass on that. It's actually good for all of us if you do.
So wait a week and a half or so? I mean,
about 7 days. If you're still having symptoms after 7 days, then antibiotics might be considered.
When you're thinking about whether or not to do any of these things, Dr. Santa, what's the #1 question you should ask your doctor to differentiate between whether you fall into the category of should do versus should not do?
Well, you need to ask them, do I really need this? Tell me why I need this. What are the downsides? What's the safest, simplest option? One option always is, well, what if I did nothing? What if I waited a little bit? And also, you know, what does this cost? How much is this going to cost somebody, including me?
Dr. John Santa, great information. Thank you. We appreciate it.